We shall seamlessly move on to the next session, and all the expert panel of the previous session are most welcome to be here because they're absolute the treasures for us to understand more on this very important subject. So after having dealt with the specifics which were looked into in the last session, now we go on to the measurable components, and I'm just breaking the queue and talking first because I have to go for the session.
To invite the expert panel.
Yeah.
So, I'd like to now invite Dr. Devashish Sabeta, sir. Please, Dr. Sudhang Bharti, sir, Dr. Kamal Kapoor, Dr. Mohan Rajan, and Dr. R.D. Ravindran, sir.
Yes.
Sir, please come on the expert panel. So, Chitra Madam will be speaking to us first.
Very good morning to one and all of you. And my due in the next 10 minutes is to tell you all how to empower our employees and retain them in the workforce, because each of you are young people today and tomorrow you're going to have 2, 4, 10. It's going to increase. And there is no point losing your energies by running after newer recruits time and again. So I believe that the basic philosophy is allowing each of these person, of course your recruitment has to be good, you can't bring trash in, but the philosophy once they are inside is to allow them the ability to do independent decisions. Now if your work culture allows you to encourage them that even their mistakes can be, if they have understood their mistake, they can move on, but you're not too reprimanded for that. But having said that, we are in a challenge. This is not a production industry, this is a medical industry where any mistake of yours is going to be so very critical and it's going to be very costly. So we need to have all the controls in the place so that you prevent critical errors from happening. But some minor lapses, you could very gently tell them, and with, unless it can be overlooked also, but give them a very healthy, happy atmosphere to work. You know, when you start as a solo practitioner, you're thinking about the refractionist, the optometrist, the floor assistant, and everything is on your mind. And you have got into the tune of micromanaging. If you want to grow, you have to outgrow this very concept, because then only you will have a better working style. There are capable guys nowadays, 30s and mid 30s, they are so capable of running their own setup. They are coming and working with you because of some kind of a cushioning effect or the thought that they would grow with you. So you need to understand that and not micromanage them. And then if you are empowering your employees, believe me, the whole work culture is going to be very different. We had started off with a 250, 350 square feet area, and if we are what we are, really it could not have happened with me clamoring that I am I Foundation. The sooner you move out of the thought that you only call of I Foundation and not address yourself as what I did so many surgeries, I went to this department, I went to this hospital, I went to that hospital, that's out. All of us are there, all of us, and it should be ingrained in your system that even if you have just 2 doctors with you, it is a we and it is not I at any point of time. And then of course, if you are an intelligent administrator, you would have a monitoring system which should be centralized. It may not be very relevant, this many centers at your stage, but each of you are leaders. The fact that you're sitting in this room is because you want to break these barriers and go out to a different level. So to break that level, you need to be monitoring them in your own disciplined fashion, ensuring that they take their own decisions, but yet they are doing what you are. So for that, you should have multiple review meetings and discussions and open up all your things. Don't keep it all hidden with you. Tomorrow you're buying a microscope, they all need to do. Maybe a microscope is irrelevant. Anything bigger, any bigger move, if you get them all together with you and allow them to hear, not only do they get pride in knowing that the organization in which they are working is growing, but there is some contribution which is coming from them. And don't belittle them and think that they are incapable of contributing. Actually, every single brain is superb and we just need to tap it. And it's our ability to tap it is what makes us a leader and differentiates from the others. So the importance here is making each of your colleagues feel so important. Believe me, there are so many moments of truth which is going to plague them. Preoperatively, the query the patient's going to have, not too happy, you have to make them happy. During surgery, if you have a complication, the nurses are watching, everybody's watching. Post-operative, the vision is not good. So there are so many moments of truth which is anyway going to plague each and every one of us. So each of us have to push ourselves to do our little best. So why do you as a boss need to keep reminding them of that? So there should be different parameters where each of your people assess themselves. And when unknowingly, slowly, the employee feels secured and satisfied, and that is what is the positive work culture. Now, giving them the job satisfaction actually means you're giving them the stability. And I'm telling you, job satisfaction, retention, all is going to just keep ricocheting onto you because they are all one and the same. How do you hold your dear lot together? Because without your knowledge, they would start dreaming your dream with you, and you will not know which is whether it is their dream or your dream. And if it's a common dream, it's the dream because it's a big dream and it's a difficult terrain. There's so much of labor. You might think you own the place, you have money coming in, but they are going to be well paid. There's no second thoughts about it. But there's going to be troughs and peaks, and you need an enormously strong team, and a team where they genuinely love for you, when their heart aches when you're getting sick. That kind of involvement is so critical, and that is the core of realization of your dream. If you have retained them all, sky is the limit to what you can reach, because there's not going to be just two hands raised above, there's going to be multiple hands raised to get what you want. Never forget one important thing. Before you recruit a person, you inquire about a person, you check that person, sometimes even look at their surgical skill set, everything. And then when they say at some point of time they have to go, the fault is within you, not just in him. You were not able to retain him. You are not able to get the best of him. So besides losing him, imagine the time wasted in getting him recruited, training him, all those wasted discussions and all those regrets. So sometimes, yes, you would have brought in a very careless person. That's okay. That's a relief in itself. But if you're able to retain them, that would be the best. And giving them job satisfaction is the very primary goal. So we were few of us, and we are as many or lot more than this. It is because I think the only way is if all those mantras are followed, then you have less of your ability to decrease the turnover and keep all of your colleagues working at their best. Now, the next other important point is while they are working with you, giving them n number of surgeries and giving them comfortable working hours and a good room is not enough. Somewhere along the line, they are all intelligent. They may not get the opportunities to grow because you are much older. You are in a different level. But there has to be some growth which is happening. There has to be recognition of them. They should be sure that along with you in their own pace, they will grow. They have maturity, they have wisdom, they have everything when they have joined you. But you have to allow their growth. You cannot be alone doing n number of surgeries. You cannot be alone attending so many meetings. You cannot be holding on to this mic at all places. They should be holding to. We had a live surgery 2-3 months back, and my husband suddenly out of the blue, he said, every time live surgery, it would be Dr. Mahipal Sachdev, it would be Dr. RDR or all Debashish, all top guys. He said, no. We are going to have all our doctors manning different centers. And what he did was wrote without a second, he wrote in the group, how many of you want to do live surgeries? And all of them raised their hands. And I'm giving this talk today, but I was apprehensive. Will they do well? They may be shy. They have not been exposed. No, they were not shy. They were not less exposed. They performed brilliantly, amazingly, because they had treasured that. There was not a complacence. They had not just their dread less. Sometimes some of the seniors, we are a little casual about it. No, they valued that platform which they got, and it was one of the best parts of the program. And that is what is definitely a gratitude and a happiness is inevitable in that. So I'm putting it all rapidly in 10 pearls. So then, as I'd already alluded you to, the best way to gain employee loyalty is to make them feel that you trust them, that they are part of you, they are in this war with you, they are in this best part of it you in all the ways possible. And there would be variations in how they would do the job. It need not be exactly the way you want it. As long as the end result is met, sometimes you will realize that you learned something more. It enhances your vision. But again, you have to communicate to them somehow what is your your clear vision about that place. You believe in integrity. You will not have OCTs used randomly. You will not have them doing FFA. It's not needed. You will not advise cataract surgery for a person not needed. You would not advise clear lens section just because to make money, because your incentives grow up. No, the honesty and what you have, what is your mantra about that place cannot be lost. And if that you could ready to lose that employee of yours if he transgresses that, if that clear vision is across, believe me, they would start respecting you. You should have the ability to have small talks. Look at this, all those reception staff and all those sisters. There's one wonderful girl moving here. She's my room sister, and small little thing there. And she has grown to what she is. It's because I realized there was so much talent in her and kept on noticing her and kept on appreciating her. Sometimes even standing for a group photograph with them or just sharing those photographs with them, they realize you're treating them like human beings. Sometimes you just sisters, are you all lined up? That is not the approach. We are not like Arvind, that they have an excellent HR department and excellent things who are seamlessly doing it. Sometimes we are just there, few of us doing it. So it needs to have a very friendly atmosphere. We have to constantly encourage to make them learn new skills. A new equipment comes, a new surgical device comes. You should put a roster that whoever is connected in the department has an opportunity to meet the technician, learn those skill sets so that they know that along with you they are learning. It shouldn't be that an examiner machine comes, just the top 2 refractive surgeons learn it and other cornea refractive are left behind. No, that's not the way to grow. And you have to be open to ideas. When you have these review meetings, you should be prepared to go in, that you are going to get to hear a lot. You're not just going to be dictating them all the time, because all their opinions are so invaluable. Even if they come with a problem, allow them to solve the problem, come up with their own decisions, and you be sometimes, more often than not, you'll find that those problems are getting solved better. Because I do believe that 2 heads are better than 1. It does inspire creative thinking. It sort of puts a challenge into their hand that they have to do it. And they will do it. There is Dr. Tamil Arsi sitting right behind there. We just told her, take care of the phaco-refractive workshop. I thought I used to do it very well all these years, and I used to look into every tiny thing, but she just floored me the way she did it. So imagine, from now on, I have the humility to understand that she's going to do better than me. So I would keep going back to her. And I'm sure there are so many Tamil Arsis in my place, some best, some next to best, but I have to give that opportunity for them to evolve. These review meetings, you should discuss even basic things like waiting time and what has happened. Why was this patient not happy? Why was the Google review not done? What was the reason? So that they all know that for us to grow along with this organization, all these nitty-gritties have to be seen. Do not hesitate to say thank you. Do not hesitate to say somebody looks pretty. Make them happy. Even if they have made one phone call to a patient and that patient came back, an angry patient came back before them, in a group you have to announce that this doctor of yours did this for a patient. If they have done 10 years of service, 20 years of service, recognize them, give them a certificate, give them the best performer of the month, do everything. Play to their strengths. Do not bring out the negatives of them. Try to talk about all their positives, and then in that gently tell them that this might not have happened. Spend some time, not just they come to your room to tell them what they did. Share a coffee with them, or even take them out for a dinner and talk to them. Tell them what is their potential and how they did this well. Maybe why not they grow in that part of the department and take care of that aspect of it. Those small things have a great impact. I believe that when you learn to delegate problems and not just tasks, your team will grow. Because only a true and a sustainable organization is that which has empowered all its employees. You could be having a bunch of workhorses who do exactly what you want, but that's not what you want. You want those intelligent professionals to have the initiative to use their skill sets to problem solving, innovate, and all of them believe, as in my center, that I Foundation is ours, not us alone. And I'm sure in all of you, in all your setups, if you go back and look at all those faces looking eagerly at you for appreciation and recognition, believe that they have to grow with you. And if you have done that, I promise you, you are going to be winners and going to go to the next level. Thank you very much.
Thank you so much, ma'am. Yes, Dr. Sudhang, sir, you wanted to say?
Yeah, good morning and excellent talk, Chitra, for giving them an idea as to how to retain and how to grow. Another thing which I think is very important is to make them feel that their future is secure with your organization, because majority of times everyone is looking forward to join a government job, because the security of government job is different than the security in a private job. So that kind of security, we
Dr.
have to
Debashish.
spend something like 2 to 5% of our total turnover in the CSR, that is corporate social responsibility. And that corporate social responsibility goes into providing the education and
Yes.
other things to the
Yes.
children of the your employees,
Yes.
to the accommodation. You might be able to provide them a house at a later point in time. Somebody who has worked for 5 years will get some, children's education. For somebody who's worked for 10 years will get additional
Yes.
incentives, and somebody who's worked for 20 years, or has devoted 20-25 years, will get a property. So that's what it is. If you want to retain them for a long time, I think it is very important to look after their requirements, long-term requirements. So, like my organization, I have more than 50% people who are working for more than 20-25 years, only because of the reason that they understand that if they are able to impress upon me that they are doing sincerely, they will be rewarded, positively every time. Yes.
Ravindran sir, just one question. Yeah.
I'll be back within 20 minutes, and I'm going to miss some wonderful talks. Debashish, Dr. Debashish, and Ritika's, but I promise you I will be watching the uh, later recording of it. Thank you.
Yes, ma'am. So, just one question before we move on. There would be once in a while some employees who would probably come up and say, I think I'm being underpaid. I'm doing so much of contribution to your organization. I think I deserve it. And he may truly be a deserving person. And he would say that why not you increase my salary to this? Otherwise, I'll look for other opportunities. So, how would you tackle such situations?
I'll take that, Anga.
Yes.
See, Dr. Bharti said about retention, and Dr. Chitra told that organizational growth is the key thing, because, unless organizational growth happens, how do you create space for, the others to grow in the organization, within the organization? So essentially, today, out of some experience over the last 25 years, we've understood that retention may not be that good an idea, and rather putting systems in place so that we can have a very efficient training system, so that people will come and go, because in this world you can't stop anybody from growing. If they think that our perspectives are not as prospective as they think it to be, they might leave, and you have fresh people coming in. After 1 or 2 years, I think that is the best part of a employee to contribute to the organization. And this is the one thing I wanted to share. And secondly, having systems in place is, you have functions. So more the function an employee knows, maybe he won't be performing that function. But suppose there is absenteeism, there is something else. So if there's 12 function to a OPD job. Now a person knows 12 of them. So he's competent anywhere. He just goes and fills up. And so he becomes a jack of all trades. And we kind of look at leaders around these persons. They may become a center in charge. And so this is the organizational graph that we provide. So essentially, sorry, Dr. Bharti, I know what you understand and you feel so strongly, but I think we have kindly somehow drifted a little away from that.
we don't have time, but the only thing is that sometimes if you have a person who's working for you for 20 years,
Yeah. The best thing is about Dr. Bharti's point is if somebody is 35, working 10 years in your organization, the loyalty factor is very, very high.
Not
Because
loyalty
at
factor,
35,
Devashish.
this guy is not going to get employed anywhere else. So they depend a lot, and from belonging, from dependence comes belonging. I
The
mean, it's
other
very
factor
simple. Let
is
us
that you
understand
can
that.
delegate the work which you were your headache. You can totally, completely delegate your work to them and be out of it totally.
I think basically the core team, we have to differentiate from the core team versus the peripheral team.
Yeah,
The
yeah.
core team is something who is going to be with you, has been with you, has grown with you. So I think that is something they become sort of indispensable, and then maybe you agree to their demands. But it's the peripheral team, and I think none of you answered
Yeah,
that question. Maybe Dr. Ritika.
in the resilience of the systems, like when we talk about growth and systems to be synergistic, the old people, only thing, you have to really get into them to bring in change, because they are resilient to change a little bit. But yes, I mean, that's okay.
Yes, Doctor.
Excuse me. Hello. इधर चेंज हो गया कुछ. True.
Sir,
Yeah, like coming to your question.
my question.
Yeah,
Yes.
About someone coming and complaining that their salary is not increased. I mean, in a good organization, something like that should not happen. For first thing, somebody should not come and complain to you. Okay, and the way the you have to approach the problem is also like a career growth. So we need to identify people who are really potential. No, they're really doing a good job. I mean, it's always better to have a different scale of pay. You pay, no, you also give them a scale change or a different designation and promote them to a different level, so the people in that same cadre are also not affected. If you keep the person the same cadre, the same scale, and give them an increase compared to others, then it will lead to a lot of dissatisfaction. But changing that person's position, the career, and then giving them a thing is always better. Here again, no, we talked about empowerment. So here within Aravind, it's not decided by the chief medical officer, but by a group of people who will know who under whom they actually work. They decide how much that person is going to do, and it is going to be his headache to manage. If that person is going to leave, and he has to manage the department. So here again, empowering and delegating even the pay rise to the next level is always better. So,
Thank you, sir.
becomes justifiable. And
yeah,
yes,
yeah.
and I mean, I think in this little conversation that we had, that is how growth becomes so important internally also. It's not about the bottom lines and the revenue top lines.
Yes, sir.
Even coming to Dr. Chitra's talking about empowering is very, very important for retention. Not at the level of the doctors, but also the mid-level. The mid-level, if you really empower them, there it's not about retention, but better operations. No, empowering the middle level will definitely helps in the operational excellence also.
And growth today may not be simply numerical, because it's very difficult to actually, in many localities, to be numerically growing, but it can grow in content. So I mean, both parts of growth of an organization is as important. If you are not there are limitations to grow in numbers numerically, it is easier task to grow in terms of content.